One of the lessons from the pandemic that is often overlooked is the critical role that data plays in the healthcare sector. Admittedly, if you don't work in the sector, then it's not something you're likely to be thinking about. However, the importance of having your own healthcare records digitized and the ability for healthcare professionals to be able to access patient data across nationwide or even international platforms can be life-saving. And yet, despite huge tech advancements in diagnostics and other areas of healthcare, when it comes to data, the sector trails just about every other industry. However, that's finally starting to change, and with game-changing benefits. Hi, I'm Jane Singer, and thank you for joining me today on A Seat at the Table and being part of our global community, which now has grown to over 100 countries. Today I have the opportunity to speak with Robin Wiener, president and co-founder of Get Real Health, an award-winning health tech company that helps doctors to have greater access to patient health data while making it easier for patients to get health care, regardless of where they're located. In this episode, Robin talks about why having better access to data can help the healthcare sector solve some of the world's biggest healthcare challenges, how new technology is bringing better healthcare to people outside of major metropolitan areas, and what's holding the sector back from implementing technology already in use in other sectors. Before we get started, if you're a supply chain executive who'd like to finally put an end to information overload and get a simple, concise, fact-based summary of key developments and market shifts, then the current situation in sourcing is exactly what you're looking for. To get immediate access, head on over to thecurrentsituation.net. That's thecurrentsituation.net, where you can get all of the details. I'll put the links in the show notes, and of course they'll be over on our podcast website, seatpodcast.com. Now let's sit down with Robin and get an update on how IT can help solve our healthcare challenges. I'm really delighted to have you on the show, Robin, because healthcare, honestly, is just such an onerous subject for people, particularly based in the U.S., to tackle. And it's been like this for decades, and nobody's done much about it. And I just think that people will be very interested to get your views and get some clarity, perhaps, as to where some of the problems are, what could possibly be done about it. I don't need to tell you, it's not easy to wrestle with a system that is really such a tangled web, so to speak.
Absolutely. Especially here in the U.S.
Yes.
Overseas is a little easier just because of social medicine. Things do, well, it's easy in some ways and harder in other ways, but at least you're able to get your hands on some things a little faster versus all going one area.
Yeah, absolutely. Now, from your point of view, what do you see as the core challenge facing healthcare right now? And I mean, I know there's many challenges, but if you could sort of, give us some of the top ones, or, in some way narrow the focus a little bit.
Especially for what I do here at Get Real Health, we're on the health IT, the technology side of it.
Okay.
But in general, one of the largest problems we're having right now just across is the lack of healthcare workers. They're burned out after the last 3 years.
Oh, I'm sure.
I have a lot of friends that they're burned out in a way, and there's burnout and then there's burnout.
Yes.
And some of the nurses and doctors in the front desks and everybody who's working, they just are so exhausted. And the next area, so that's the doctors and nurses that have been in the hospitals and the front lines. The next area that you cannot get an appointment with, and we've been trying for some family members, is on the psychology.
Oh, really?
You cannot get an appointment with a psychologist or a psychiatrist because, everybody has gone through so much in the last 3 years that now people are realizing mental health is a huge issue.
Wow.
And now you can't, so everybody who has an area of that, there's 3 to 4 months waits. So you've gotten, across the boards in healthcare, because I believe healthcare is made of what's happening in your body, but also what's happening in your mind, your body, and your spirit. So
Absolutely.
If you're having problems with dealing with stress, I've got a child who, he's not a child anymore, but he graduated in 2020, right? So that is the whole syndrome. Those kids are having such a hard time. They didn't get graduation. They didn't finish their high school years and gone to college, and colleges were sitting in a dorm room, in your dorm room doing college. These kids are really having a hard time. You cannot get anybody to speak to them. So you've got two scenarios. you've got your medical doctors, your typical medical doctors and nurses burnt out, and then you have all this psychology. So what do you do about, how can we support that and help it and see what we can do for the patients? So that's where we believe technology, it can be some support on that some of these doctors and nurses that just don't want to be in a hospital anymore because they're burnt out, they can do virtual calls. They can have those conversations from the comfort and safety of their homes, and to do work when they are comfortable to work. And people are now used to it, right? Before, having a virtual call 3 years ago was like, oh my gosh, this is crazy. Yes. And now it's, oh my gosh, why wouldn't I have done this, right? Because it's so much convenient, right? I do think the biggest problem right now is the lack of having the support out there that we had before this all happened. But there's a lot of things we have to get back online and get caught up in the medical world. But I focus on the technology.
Yes, I definitely hear what you're saying, that the burnout has got to be absolutely awful amongst people in the healthcare sector. They really took a beating from all of this. It's unfortunate that there wasn't much support for anybody in that sector. Now, you said that there's technology that can help, other than being able to do remote, I don't know what you would call it, but what typically used to be an office visit remotely in many cases. Other than that, what other technology do you see coming through to help?
So what we do at Get Real Health is, we've been doing it for years. We were doing it before it was popular. Right. Is the ability for you as a patient right now, when you're out there trying to figure out your healthcare. So now things have gone to virtual, virtual online, et cetera. But you're saying, well, my information is, I need to be able to see all of it. And what's changed now, some of the power has been pushed back to the patient, right? But you need to be able to have that data within inside your hands, right? So how do you get that data? Because what we want to be able to do is now be able to look at your whole life and say, hey, what's going on in general with my health? And one of the things one of my favorite taglines we have is, see your patient like you've never seen it before. Usually you would go see the doctor 2 to 3 times a year, and the doctor would only see you 2 or 3 times a year. Right. What we need to be able to do is empower the patients, empower us to be able to see what's going on with me all the time. So now with technology, and these would be patient portals, but now there's really something called the digital front door, where we're able to combine information from your doctor's offices and your hospitals and everything to one area. So you can start to say, okay, you know what, my blood pressure has been up for X amount of time, or I'm not eating the right food. And when I don't eat the right food and I don't work out, my blood pressure goes up. Right. If I, those kind of pieces. So what we are able to do now, and this is really starting, we're working with one of the largest hospital systems here in the U.S., is the ability to get all that information in one place, but then add on all your devices, your Apple Watches,
interesting,
your Fitbits, your blood pressure cuffs. So it's one thing to have what happened in the hospital or the doctor's office. Right. But what happens when you start layering on what's happening in your daily life? What happens when you say, so that's one side of it. The other thing is to be able to monitor our health consistently. One of the biggest things is now being able to have scales where, let's say one of our parents, all they can do, all you want them to do every day is just step on the scale. That's all. Nothing more than that. Step on the scale. Well, you're able to, as a daughter, able to monitor that scale step on, and you have an alert, and it says, as mom gains 5 pounds overnight, I get an alert on my phone, says mom's gained 5 pounds. What that will tell you is she's retaining water and could be going into heart failure. Oh, gosh. Right? So that all of a sudden empowers you to be able to say, not that what you're going to do is say, I'm calling a doctor. Now, I need to get the doctor involved in this, right? Right. I have a son who's a type 1 diabetic. I'm able to watch not only his sugars are all the time. He actually just went onto the pump. I can also watch to see how much insulin he's getting. So I can see when his sugar is high, is he correcting with the insulin? Because it's all attached to his body. So I can look on my phone and be able to manage what's going on. But the other thing is, if he goes too low, I'm able to see that he's going off a cliff,
Right.
I'm able to look at the GPS location of him and get to him in time to help him.
Wow.
Or get somebody in that. If his sugar is going down, I need somebody to get some apple juice into him immediately. What that also helps is when you have that virtual call, because before you go in the doctor's office, they take your blood pressure, they have you step on the scale, they do all those kind of things. If you're doing this consistently and are able to do it right in front of them, the doctor can start to see trends.
Yes,
and see what's going on, and be able to make a much better decision on changing a medication. Seeing what they'll do is on the virtual side, and then they'll say, you know what, I really need, I need you to come in because I'm watching each piece of this happening, and bring them in. So that's where technology will be really supportive of basically empowering us to be able to start taking control of ourselves and our families. So that's where I do think there is a real power. And we're seeing it, we're working with one of the largest hospital systems in the country, but we've got over about 300,000 people, soon to be 300,000 people in rural America doing this right now, which is an area that is often forgotten
right.
in the United States. I live on the East Coast. I'm lucky enough to live outside Washington, D.C. Might have the best doctors and hospitals in the world. John Hopkins is a 30-minute drive from me.
Right.
Or on the West Coast, a lot of times in the middle of the country, we kind of forget that's not given as much attention. This is the ability to be able to do all that and then take that data. If the patient wants it, we can actually find out if somebody has some chronic disease or been diagnosed with cancer. The next step is to be able to, if the patient agrees to it, to be able to let people know that we have this great database of people that have these things and be able to connect a patient with a clinical study and bring them together. So there's some really cool things that we can do with empowering the patient with the data, and then if the patient wants, being able to take that data and be able to get them the support they need in other areas.
I think that's really interesting because you're right. If you're in a metropolitan area, whether it be in the US or elsewhere in the world, you tend to get used to the fact that, like you said, so many things are within striking distance. You have all this medical support nearby, but there are many, many people who live just far enough away that it becomes very difficult in order for them to get regular treatment or to be able to get any treatment. So
Absolutely.
The implications on a global scale are actually very, very interesting.
Absolutely. No, we work in multiple countries, the UAE, Canada, UK, Amsterdam, New Zealand, Australia. And when you get in some of these countries, you realize how big these countries, in Australia, you think, oh, Australia, same kind of situation when there's a lot of rural.
Right,
a lot of rural.
Right.
Canada, there's a lot of rural.
True.
And able to empower people to be able to do this is great. And what we are finding too is because we have clients and our clients are overseas or Department of Health, like large Department of Health, we're starting to see the Department of Health are talking to the Department of Health.
Interesting.
And that is a really great piece that we're seeing too.
Yeah, I think that the ability to share information is also important. I mean, as we've seen, particularly during this pandemic, the ability for multiple nations who are experiencing the same situation to be able to pool that data is huge in terms of getting towards a solution or being able to predict possibly what might be coming next. So you're right. I think that ability is very, very important.
Yeah, we've seen a lot with COVID where Israel seems to be a bit ahead.
Yes.
And having information come from Israel back over to the U.S. or other, to the World Health Organizations, to be able to see the best practices that are happening across the boards. So even on the vaccination passport, we all came together we were part of a team here in the U.S. that worked with the World Health Organization. And that's still going on of how you can share that information cleanly and clearly. But we took standards that are typical standards and tried to roll them out. We run the vaccination passport for the province of Saskatchewan, Canada.
Right.
And we're able, but that technology is the same technology that's being used in the U.S. as being used in the different areas. And that's the kind of thing is when you look at a global side, you want to make sure that you are connecting these different technologies together to be able to talk to one another, to be able to get those results, be able to help one another. If anything, the last 3 years has said is we cannot be siloed.
Right.
We need to be able to talk to one another and figure out how to do this. And this is for COVID, but how powerful would this be for other diseases that come up?
Right.
And other areas, because what we've talked about, even on the vaccination passport, that's really just focusing on COVID. We've just come out with something called the emergency access QR code. So if I'm traveling and I get in a car accident, I go into the hospital, there's going to be a QR code right in my wallet that somebody can scan. And we call it break the glass, because you only can do it, scan it once. Will tell you who my husband is, or who it is, and what my major medical problems are. So the doctors right instantaneously will be able to look and say, okay, she's on this medication, she has heart disease, she's got this, and this, and we have to call her husband.
Right.
And it's a log of telling them that happening, but that also works if I go overseas. And if I'm in a country that might not, that it's a little easier in the US, they can pick up the phone and call a doctors or whatever. But overseas, at least give them the basic information. So we think that's the next phase, to be able to give people the peace of mind that if something's out there, people now know how to do a QR code, which brings them to a website. And we audit that, and we have a back audit, so we know if somebody has come into somebody's site through the emergency access, that there is that somebody has we call it break the glass. Somebody has broken the glass, that we know that there's a problem, and their family can be alerted that something's going on. So this is where technology is taking us.
Yeah, I think that's a really interesting sort of an add-on to what you're doing. And you're right, healthcare data is very siloed. My brother's COO of a company that specifically does data integration for the healthcare sector. And they have many, many prestigious clients in the US, but also in the EU. And I think they also have a fair number of clients in Asia. And it was much to my surprise, is everybody has their own system for keeping data. Yeah. It becomes very, very difficult to do these studies because you first need to not only get the data, but you have to integrate that data, as you know, into one big database that's very complicated. A lot of data points that need to be brought together.
We do it every single day. I mean, and that is a big, so we have the system on top, but we have to integrate those systems together. And that is what we do every single day. And to be able to, and that's where these standards become really important.
Yes.
There's something called the FHIR standard. So that's the standard that we used when we did the vaccination passport, because that is going to, information has to flow from multiple places to be able to do it. But we integrate into some of the largest hospitals or countries, and we have to be able to integrate. And if the data is correctly done, and what we call FHIR now, it's much easier. We started doing this. Our first large hospital that we integrated with is New York City Health and Hospital Corporation in New York. And their technology was so old. I mean, it was about 8 or 9 years ago, and you just wanted to pull your hair out because we were getting terrible data and things. In the last 10 years, we really worked on getting it more standardized. And what's nice about it, we standardize something in the US, and sometimes it doesn't roll over to the other countries. And for FHIR it's taken off in such a way that's being adopted in so many of the other countries, and which makes it so much easier for myself or your brother, like to be able to say, okay, I can get what's going on in the UAE to be able to talk to what's going on in the EU. It has to be permissioned and all that kind of stuff. But, when something like COVID happens, the World Health Organization needs to have that information pretty quickly. And now we're able to bring it around. But you do have silos. You have some of the biggest EMR companies in the world or out of the US that don't want to share that information.
Wow.
And so we've got some new rules and regulations here in the US, and interoperability rules that said you have to share it.
Wow.
You cannot hold it anymore. And they will fight, and they always will fight. But now they have to. And because of that push, and because of some people that really pushed on that, we're finally seeing that movement. But like anything, I live outside Washington, D.C., everything is hard to get done. Right. You got to get to both sides of the house to agree on it, and et cetera. But we're starting to see where where something 5 years ago was there's no way that's going to happen. We're starting now to see it starting to actually take hold and going. It's a little harder here in the US because we are very siloed. Overseas, when a government makes a decision, everybody kind of has to, even in social medicine, they have to follow it. In some countries, it's very different. We work with Saudi Arabia and things like that. It just will happen. But some other countries, it takes a little while to get there. But the good news is we're seeing some really good progress.
It sounds really great, and it sounds like an important breakthrough. What's holding it back from being more widely adopted?
We're going to take a quick break now, and then we'll be right back.
We were hiring when we were making 50 to 100K monthly losses.
And why? Welcome to episode 1.
I can't think of a single founder who's been around for a decent amount of time in business who hasn't had their tunnel of year. This was that year. We're going to be okay, yeah, Sheree. Some are going to hear this and think, you TDP. But hear me out. You only have to do the math to understand that very soon we were $500,000 down.
I think certain corporations are trying to put a blockage because data is money. Data is worth something. So they want to hold on to it. So there is that piece for many, many years, really up until COVID hit. People were fighting it. They were trying not to. And I think if anything, COVID was just terrible, absolutely terrible. But in our world in healthcare IT, it actually pushed us forward because we had to. We couldn't put up those blockages anymore. We couldn't say, let's think about it for the next 2 years. And very much in health technology and healthcare, it's been so far behind compared to banking, compared to all the technology. They're still working. Many of the systems are still built on something called MUMPS, which is from the 1960s.
Wow.
It's old technology, really old mainframe technology.
Oh my gosh.
Yeah, no, it is crazy how much it's mainframed. We weren't in healthcare when we first got into it. We came as a professional services company, got into it, and we were just shocked by how backwards the technology was. So some of these very, very large systems are built on old technology. So they have to be able to convert that to the newer web-based technologies. And that is a huge lift.
Yes.
So they're trying to get there. They do too much analysis. They're not agile. In technology now, you need to be agile. You need to try things. If it doesn't work, move on to the next thing. There's so many of these older companies that just don't want, they're dinosaurs. They're trying, let's think about it a little bit more. Think about, the last 2.5 years or 3 years now, there wasn't a time to think about it. You had to do.
Right.
You had to do. You had to go. So it really pushed technology. My hope and a part of my fear is that they say, okay, we did that, but let's go back into our shell and think about this a little bit more instead of just keeping agile. So my fear is they're going to do that. My hope is a lot of the companies will say, no, we are actually on a road now of taking technology and for our citizens and our patients and giving them something that actually is meaningful for them. And we have to think about technology in the hands of the patients. When you look at a website, it should, or on your phone, an app on your phone, it should be just like you do if you were on Netflix or Facebook or whatever. It should be the same kind of feel. You kind of know how to do that. You know how to swipe left and right and pull things down. Why can't healthcare be just like that? And that's how we've built our things. But so many of them are still kind of clunky and old, and people don't have the patience for it. So we've got to keep pushing that technology to the point where it becomes secondhand, that people pick up their phones and think nothing of it and are able to really feel comfortable about it. So I think that's where I believe that my hope is we continue on that path. And my hope is some of the larger EMR companies take their old technology and get it to the new technology. And there's a lot of money that needs to be put into that, but that is our hope across the world, and then having the rules broken down that people can talk to one another with that technology. If we always say patient consented, Patient says, yes, I want you to be able to talk to this other country because they have something really interesting going on because I've got this unique disease. And most patients will say, like, if they can get healthy,
sure,
they're going to be like, talk to anyone and everyone. I don't care. And so most patients are very open to it. And it's so funny because some people, patients won't want doctors and nurses or the CFOs and CIOs and stuff of hospital systems say, I don't think they would want that. And my question back to them is, would you, if you were sick, would you want that to be able to do it? And they're like, well, yes, but I'm unique. I'm like, no. You're not unique. You're not unique. Anybody who's sick wants to be able to know the newest technologies.
It's interesting. And I think that, you had pointed out that basically there's so much overwhelming demand for healthcare that there's less incentive, I suppose, to become more competitive. You sort of typically become more competitive when you're fighting for demand, when there's more competition. But when you're in a situation where you don't have competition and you have a lot of demand, it's easy not to change because change is at best disruptive and at worst expensive. Now that it appears that we're looking at the back of COVID, what will really incentivize this kind of change?
In the past, incentivization was from the government here in the U.S. The first thing, 10 years ago, we weren't in the U.S. Most of your records were still on paper.
Yes, that's true.
It was still on paper. So where our story starts is really after Katrina. Everything got flooded in New Orleans. So all your paperwork at home got flooded. So you went to the doctor's office. All of that got flooded.
Wow.
So, well, you know what? I'm going to go to the hospitals. I'll have it. Those servers blew up. Right. So they had nothing. So now you're showing up to Dallas and showing up to Houston and saying, I have cancer. I'm on chemo and I take a pink pill. That tells you nothing. Right. The doctors are like, we're going to start over. So that's where the first thing that we started to see. And this is where we started our career, really doing this patient portals in the cloud with Microsoft. But what ended up happening there is the government stepped in and said, you know what, we're going to incentivize you financially to go ahead to the doctor's office and say, to get everything, all your paperwork, all the paper onto electronic web-based site. So this is what the first thing they started. And then what they did is that was the carrot. And then after 4 or 5 years, the stick was, if you don't do it, you lose some of your Medicare money.
Oh, interesting.
And that, if you notice, almost everybody now, if you go to your doctor's office, it's all electronic. It is on electronic. And now what they're trying to do is get those servers out of the doctor's offices and get into the web. And that's where the newer technology comes in, where it's not on a mainframe, but getting to something bigger and larger. So those are the kind of incentives that have worked in the past. The other incentive is patient demand. Patients are more, in the last 3 years, the demand, first off, nobody thought you could do a virtual call. That was different.
Right.
Every time you went in and you did a lab work, you would have to get in your car and you would have to go to the doctor's office, wait there for 45 minutes, see the doctor for 5 minutes to tell you that your labs are done and fine. You're perfectly fine. And then you drive back home, like walk out of there, pay your bill, walk back home. Well, that's a 3-hour stance. Now you do your lab work and you log on, you talk to your doctor for 5 minutes, you log off and you go back to work, or you go back to whatever you're doing, right? So patients are saying, wait a second, I like that.
Yes.
I want that. I want to be able to do that. So patients are going to start to demand, if my doctor's office does not do virtual care, I probably will move to another doctor's office. So some of that we'll start to see people having to use that technology and get up there and be able to do something faster. So the biggest thing is when the patients or the citizens start to demand and expect it. They don't understand why that's not happening. And here in the U.S., we get used to things very, very quickly.
Yes.
And if it's convenient, we're going to want it. Right. And I think that's what we're really truly starting to see is that convenience. The other side of it is it opens the door for you to see doctors outside your state.
Interesting.
And so if you are in rural Iowa and you need to see a specialist, before that would have been a flight into New York or DC or LA or something like that, or Chicago, to see that maybe that specialist. Now you get an appointment, and at least for the initial couple calls, you can do it virtually, and you'll be able to do it. So there's going to be more demand to those top docs to be able to get in and start to see them and be able to do those kind of things. A lot of times in our parent company, CPSI, does a lot of work in rural America, and these patients would have to be flown by private jets from one place to another, because they wouldn't be able to get to those doctors. Right. Now, not only they can see those doctors quickly and catch things that maybe it won't mean an emergency flight. So right. I think that demand is going to be there. And I do think there will be more incentives. I know with CMS, which is the one that does a lot of it really sets the rules in the sense of reimbursables and programs, we'll see more and more those CMS rules will come out with more and more demand for those pieces. Right. So for us here at Get Real Health, because we do this digital front door, that is what we do for a living. And we are starting to see such, knocking on a door saying, hey, we need to upgrade. We need to get to the point where we're bringing all that information to one place, empowering the patient. And by empowering the patient adding all that information, it's actually empowering the doc to make better decisions. So we're starting to see the knock on the door because patients are pushing. There's incentives around it. But these hospital systems or large doctor office or government for us, because we do a lot of government, are saying, but how do we get there? Help us, help us, help us. And so we're absolutely seeing such a push right now.
It's interesting because I was just talking maybe a few weeks ago with my brother about the role that Amazon could potentially play in the healthcare space, simply because of all the back end that they've built and the vast network that they have amongst all their Prime subscribers and the resources that they have. And so it's interesting that you bring up all of this. How do you think Amazon could potentially figure into this?
They're already figuring into it. So one of the first things, so I've got a lot of friends who work over at Amazon and Amazon Health. So the first thing Amazon did was make the ability for you to get your prescriptions.
Right.
That was their first thing. They bought a bunch of companies, and now you can go ahead and order your prescriptions, and they show up at your front door right there. And so they're actually going off to the CVS specialties and the Optum specialties. So that's the first place you're going to start to see that, right? So they can do it. The other thing is to be able to, and they're not there yet, but eventually they'll start working with the doctor's offices as a part of your care plan. Right. I'm going into the hospital. I'm going to need these supplies at the back end of this and this medication. So, if it's wound care, those kind of pieces, everything's going to be automatically, you're going to be able to almost do kind of a pre-order of your care plan. I need to order this, this, and this. Amazon's going to be able to fill that for you in a very quick, to have the relationships. As far as integrations into their pieces, they have been a lot of conversations between them and a couple other large organizations about it. I would say about 4 years ago, they were really, really pushing it. I think it's slowed down a little bit.
Right.
With everything that's happened, because they basically, Amazon supplied us with everybody in the U.S. for the last 3 years with whatever you needed, right?
Right.
They were able to get the supply chain into us. I think we'll start to see them coming back in. The other one that plays a big role is Walmart. Walmart has been talking about this. We've had conversations with Walmart as of 10 years ago.
Wow.
Walmart not only has these large distribution centers but they are also brick and mortar locations, especially across this country. Walmart becomes your town center, your main street. And with that main street, they have a clinic inside that. They have a clinic, they have a pharmacy, and you have your supplies. So they become this and they've been talking about this for years, and they've done some of it where you can actually, you go into the clinic, they diagnose you with type 2 diabetes, they give you a list, you go out, you buy all your supplies right out there, and you pick your medication up here. And so you've got this kind of right in your own little area. So you're going to see the Amazons, the Walmarts really coming together and being able to build. And then you get the Walgreens and CVSs, which are right behind them. And you're going to see all of those big box players or virtual players coming into healthcare pretty quickly and partnering with some large hospital systems or organizations.
It's interesting to see this shift because particularly in the US where we don't have national health, you have what I see as a growing a subset of the population that's either underinsured for healthcare or not insured. And that appears to be growing simply because there's sort of a shift in companies to want to take more people on as consultants simply to not have to, for one reason, to carry all of, all the benefits that you have to give people if they're full time. That's not the only reason. And there's more people who opt to want to be part of the gig economy, wanting to do their own thing. So when you have that many different factors, the base of people who somehow can't get insurance for whatever reason is huge. And it's very difficult if you're in the US and you're not able to get insurance from a company. It can be somewhere between impossible to crazy expensive. You don't need me to explain to you the whole situation.
People are starting to use the ACA a little bit, on affordable care. But along with that, some of the things, so having a son's a type 1 diabetic, insulin is
right.
insanely big. So companies like Walmart, they've gone out and say, we will supply you with a less expensive, insulin's the same all the way across the line. It's just the way the pharmaceutical companies will do things. So companies like Walmart are going out and saying, you know what, we'll produce it ourselves and be able to supply it along with test strips and those pieces. We're going to start to see more and more of that, where the big box organizations are going to step in and say, listen, we can supply you with your medications in a way, with the tools that you need to be able to manage your health. And we will see them coming out. And I believe there's even some programs that you can get healthcare through them. And it's, affordable. It's the low end, it's really, God forbid something terrible happens kind of piece to it. And so I think there is a void there, and we're going to start seeing it, especially right now with inflation being so high.
Right.
People are looking for anywhere they can to do it. Even for myself, I went out and got my coupon. It's $5 versus $200 a month. It's $5 a month. You can absolutely see people starting to make sure they are getting these pieces. That's a whole nother area. The pharmaceutical world is another whole area that here in the U.S. our drugs are more expensive than pretty much anywhere else in the world. And it's funny because they're all these companies are here, right?
Right.
But we're going to start to see these big companies being able to buy things in bulk, bring prices down, and being able to see it. So I do think when we are looking at, and especially with the lack of doctors now, the Walmarts, the Walgreens, the CVSs, you're going to see these minute clinics, the small clinics around that are able to bring in visiting nurses or, they see a lot more PAs being able to make decisions, physician's assistants. And we're going to see a lot more of that happening because of the lack of being able to have that doc right there. You're going to start to see where they can go into a large organization. The doctors don't have to carry all that insurance to be able to, and the insurance and all those kind of malpractice insurance, all those kind of pieces are going to be helped with these large corporations covering some of that. They don't have to pay staff, which is expensive. They don't have to have insurance, the health insurance for the staff that gets through the corporation. So we're going to see a lot of them shifting under that kind of place. And for the citizens and the patients to be able to say, I can just go to my Walmart and be able to get everything I needed done there.
Interesting.
It's convenient, I can do it. And then we'll start seeing virtual being able to be done on that side too. So I do believe there's a change. And then with systems like ours, with the patient can actually do all that from home, make your appointments, pay your bills, all those kind of things at home. Convenience is going to be the drive. We are too busy in our lives. And I think if anything, people are realizing life can be short. So make sure you get things done very quickly if possible.
Yeah, I think that makes a lot of sense. And I think it's very interesting that you were saying the big box players would be moving into almost like private label medicine in the same way that they private label everything else. So the fact that they'd be going into private label not off the shelf, right, pharmaceuticals, but
But
actual prescription pharmaceuticals could be done as a private label when you have the scale, as you're pointing out. I think that's very interesting.
Walmart's already doing it with insulin and with test scripts, and they've been doing it for years. So, so those are the kind of things you're going to see. And I do believe these larger corporations are going to be able to have the buying power to be able to make those changes, where a small pharmacy sitting on a main street is not going to have that power.
Right, right. Well, I mean, we've seen that in so many other categories. I think you're absolutely right, Robin. I think that the time is really ripe for this kind of technology, for preventative, as you're saying, but also to be able to sort out this kind of a conundrum with people not being able to get treatment, with costs being off the charts for just about everything. I think that technology's advanced so much, like what you're doing at Get Real Health. It's almost a sin not to be finding ways to implement it.
It really is. I mean, and what it does, it empowers you. Part of the problem with even for mental health inside of it is we feel like we can't do anything.
Right.
So when we start to put that data back into the hands of that patient, they start to be able to say, there's something I can do. I can take my data. I can get the special help I need. I think it's something that makes people feel better about what's happening. It just makes people feel better about it.
I think this is a really exciting breakthrough. And I think that there's just so much practical application that the market is really craving for the kind of technology that you've brought forward. How can people find you, Robin? How can they connect with you?
Easy enough. Go to our website, getrealhealth.com.
Okay.
Or info@getrealhealth.com, or honestly, robin.wiener@getrealhealth.com.
Okay.
But follow us on LinkedIn.
Okay.
Follow us on LinkedIn and follow us on Twitter.
Okay.
And those are in some on Facebook too. We're on Facebook, but I would say, especially on LinkedIn and Twitter, almost every single day we're tweeting or putting up a post about where we're going, where the technology is going.
Nice.
And I find that is usually, and then from there you can click onto information. Like you'll be able to find us very easily.
Yeah.
But it's a great way to kind of understand what we're doing.
Okay. Well, I'm going to put all these contacts in the show notes for this episode. So I really would encourage people to reach out to you. I think this is really very, very important for everybody. I mean, everyone cares about their health.
Yep. And you care about other your family members too. So this is a great way to really empower you.
Absolutely. Well, thank you for joining us today.
Fantastic conversation. Really enjoyed it.
I hope you enjoyed this episode of A Seat at the Table. As I mentioned at the beginning of this podcast, we're adding a new feature. If you've ever listened to a podcast and thought, I have a question, well, now you can ask. We'll be letting you know about upcoming guests on our show, and you can send in your questions. Also, you can ask questions after the show, and we'll forward them to our guests for feedback. If you'd like to participate or just want to learn more, head on over to our website at seatpodcast.com. That's SEAT podcast.com for all of the details. The links will also be in the show notes. You can also leave any thoughts, feedbacks, or suggestions there, and yes, I will read it. Thank you for joining me today. I'm Jane Singer, and I will see you in our next episode of A Seat at the Table.